Ginger Ireland Hoffman was doing her part to save lives by donating blood. That act of giving led to the discovery of a life-threatening heart defect. Today, we have her unique story and how surgeons saved her life. Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. Anomalous right coronary artery, or ARCA, is a congenital heart defect, one that often remains undetected until it's fatal, which is why Ginger Ireland Hoffman is so incredibly lucky. We want you to know that our program today will show graphic medical video. As a highly respected and beloved cardiothoracic ICU bedside nurse at the University of Kansas Health System, you could argue the only thing Ginger Ireland Hoffman has ever failed at is fostering dogs. She winds up adopting them every single time.
I got it. Is that yours? Is that Rudolph? He's all yours.
Ginger is one of those people who gives 110% to everything and everyone that comes her way. And it turns out the very act of giving blood, something she does multiple times a year, is what saved her life.
I have an anomalous right coronary artery.
Ginger says she never had any symptoms of the heart defect she was born with. But in 2017, at a routine blood donation appointment, everything changed.
He took my blood pressure and goes, "Did you run here today?" And I was like, "Yeah, no." He goes, "Honestly, if it was me, I'd go to the ER." And I'm like, "I feel fine. I've never had high blood pressure a day in my life." 10.
Ginger did not go to the ER.
In denial. I was confidently in denial.
But she did schedule an echocardiogram for a few days later. And soon after that, she got a phone call from health system cardiologist Dr. Ryan Farrell.
He said, "Your right coronary artery is malpositioned and it likely needs to be moved."
Ginger needed open heart surgery.
I think I was numb.
She would later learn it's the kind of heart defect so sneaky it's typically diagnosed in autopsies after something sudden and terrible has happened.
Hey, baby.
8 years after the open heart surgery and rehab, Ginger is feeling great. And now she uses her own experience to help her patients.
That's a lot of a fear for most of them is, will I ever be able to go back to work? Will I ever be able to live the life that I had before? I'm like, you will. And maybe you even live a better life than you had before. Because I definitely am light years above where I was at that point.
We are so happy to have Ginger with us today, and she is working today, so she's taking time out of her schedule to join us. You look great in scrubs.
Thanks.
How are you feeling?
Good, really good.
Was watching that tough?
A little, but
Yeah.
I mean, it's the thing that put me in the place where I am today, working with these two wonderful surgeons and all the great people I work with.
Let's talk about the amazing surgeons that we also have joining us. We have cardiothoracic surgeons, Dr. Trip Zorn and Dr. Gregory Muehlbach. You did not operate on Ginger, but you do these kinds of operations all the time, and you now work closely because you're all in the same unit, which is so cool. How often are you rubbing shoulders with these guys and working on patients together?
I guess it depends on the weekend and who's on call, because I primarily work weekends. Pretty frequently. At one point in time, I felt like I was only recovering Dr. Muehlbach's patients.
I could tell you have a good relationship because you came in and you said, uh-oh, these guys. I'm going to start laughing if I'm next to them, or
Right.
something like that. Ginger, you had no idea that you had this heart condition until you went to donate blood. You said you had no symptoms. Looking back, is there anything you think you might have missed?
No.
No signs?
No, not a thing.
That's really alarming.
I
to
was
hear that.
running probably 2 to 3 miles a day
With this.
at that time.
So Dr. Muehlbach, well, first of all, when you hear she was running 2 to 3 miles a day with this, as a surgeon, is that alarming to you? Was it like a time bomb in her chest?
It's hard to know because there are people that have this that are asymptomatic and can live with it forever without a problem. So
Really?
it doesn't necessarily cause sudden death in everybody, but there are variations of this that are more malignant, if you will, that need to be addressed like hers.
And here she was cruising along, just Ginger being Ginger, and had no idea. You shared some really great images with us. I want to share them with our viewers. Can you, Dr. Muehlbach, explain, when we're looking at this, how is a heart with ARCA different from a healthy heart?
So the picture on the bottom really shows what the normal anatomy of the coronary arteries off of the aorta would be, so that the left main artery going behind the pulmonary artery and the right coronary artery just comes out directly to the front of the heart. But in Ginger's case, the right artery that we see there that comes off the front would actually be coming off the same area where the left artery comes off, and so it gets pinched, if you will, between the aorta and the pulmonary artery.
And so what's happening then that's making it so dangerous?
So that pinching, or that slit, if you will, especially in exercise, when the blood pressure goes up or the pressures on the right side of the heart go up, that can compress that artery even more. That's just limiting the blood flow to the heart. It could essentially causing a heart attack.
If most people, Dr. Zorn, don't show symptoms or can live, as Dr. Muehlbach was saying, their whole life with this and it not be detected, are there things that people watching this program need to look out for, or a test they can request?
Well, the things to look out for are, some people will get symptoms. They can get chest pain or shortness of breath, or they can get lightheaded and pass out. But as Greg said, one of the biggest problems is sudden death, and that people can die suddenly with this without symptoms. So they're often picked up, like hers was, with mild symptoms and a routine physical exam and blood pressure check, and then you get a diagnostic study. And I think it was great that Dr. Farrell and his team picked it up from the echo and went on to get the other diagnostic studies that really picked it up, that really defined the anatomy and let us know what it would, where the vessel was.
And it was the guy that was taking your blood pressure before you donated blood that noticed. How high was do you remember how high your blood pressure was?
200s over 110s.
Did you feel fluttery or nothing?
No.
Do you think you were confidently in denial?
No. I mean,
Not at that point yet?
It was like just a normal Tuesday.
Wow.
Nothing any different than any other day.
No.
Dr. Muehlbach, you also shared some images of Ginger's arteries and some scans of her heart, and I want to show those up, and I'd love to have both the doctors talk about this. What are we seeing in the first image on the left of the screen?
So this is newer, but not that new, but newish kind of scanning, where they can actually do a CAT scan as opposed to doing a cardiac catheterization, and then kind of three-dimensionally, if you will, re-image or show the heart arteries. And so the heart's beating, so this is what we call gated, so the images are taken at the same point in an EKG at the same time.
This is a very basic question, but what is it? Is that her heart we're looking at?
So the bright circle in the middle image, if you will, is the aorta, and the line coming out of there is the coronary artery. And you can kind of get the sense that the artery below, at the mid portion, is a certain size, but at the upper portion you can see how it kind of tapers down, and that would be kind of what we would say a slit-like orifice, if you will, that kind of gets narrowed. And on the right of that is the pulmonary artery. And so this is taking this course between the aorta and the pulmonary artery that is what we would consider more dangerous to the patient as far as causing, ischemic complications.
And I actually need to clarify, those aren't Ginger, those are another patient that
Correct.
you did see. Okay, I'd want to clarify that. So what you saw here would be similar to what was happening in Ginger.
Yes.
Dr. Zorn, Ginger underwent something, it's a complicated name for someone who's not a cardiothoracic surgeon.
Yeah.
A coronary artery bypass graft with unroofing.
Right.
Ginger knew what that was because she's a nurse.
Right.
But if I was going to get that, what would you be doing?
So, so two components to it. So there was kind of a belt and suspenders, or a double way to approach this. So bypass, there was, we use conduit or vein from the leg to take blood flow from the aorta and go to the end, or the distal end of the perfusion of that blood vessel, and to supply flow. The unroofing is addressing the slit-like orifice that Dr. Muehlbach was talking about, where we actually open up from inside the aorta and divide the aortic wall and then suture it back so that the narrow opening is now a wider opening, like a normal coronary artery has.
Does unroofing always happen in coronary bypasses?
No, it's only in these anomalous vessels that have a slit-like or a narrow opening where the blood vessel is actually kind of running inside the aortic wall for a short period of time.
And that's ARCA. So Ginger, when you hear that you're going to have this big surgery, does being a nurse on the cardiothoracic unit, does that make it less anxiety ridden because you know a lot, or is it way worse because you know a lot?
So when I had my surgery, I was in the medical surgical ICU.
Okay.
Not a lot of cardio stuff happens in that world. It's more renal and liver and things of that nature, respiratory driven. So I didn't have a lot of information and a lot of understanding. Now when I hear it, I'd probably get palpitations.
Okay.
Oh, who's next?
So it was good that you didn't know?
Oh yeah, I would say definitely.
Because you would have been
I would
even
have been more
nervous.
anxious, yeah.
I remember during our interview you said that basically everyone you talked to along the step of the way, you said, no big deal, I'll be fine, I'll be out in a day. You told your son, don't come home from Japan, I'm fine. And both your kids were like, Mom, we're coming home. Is this something you do as mom, just downplay
I think it's
major
more
things?
as a medical professional than a mom. I mean, because we want to save our kids from any pain or any strife, and you don't want to take away from them living in the moment. And I'm just going to be in the hospital a couple of days. You guys don't need to come here. Medical staff is here. My friends are here. I'll be fine.
I could see any mom doing that. You're right. Because anyone with a mom who's been in the hospital knows they don't find out till she's already there. And she said, I didn't want to bother you. So that was you?
Yep.
I'm glad you're okay, and I'm glad your kids saw through that. Yeah. Why is it so important, Dr. Zorn, for her to have this surgery quickly? Hearing her story and hearing what Dr. Muehlbach said about her running, how close do you think she was from something bad happening? I know you're just have a crystal ball, but
sure. So some of the testing she had was has even more sophistication at looking at the flow reserve, so fractional flow reserve. So not only can we tell the anatomy, but we can tell the physiology and the flow along that area. And hers was in a border zone that suggested severe stenosis there. Yeah. So I wouldn't call it a true surgical emergency. We weren't, firing up the OR and going right then. But the biggest problem with it is the lack of warning and that the sudden death component to it. And even though this is an uncommon entity that does not always have sudden death, the problem is we don't have really good markers of who that can happen to. And so trying to get this off the table and out of the way so she can press on with the rest of her life.
Right. And pressing on you are. You're one of the most favorite nurses that we hear patients talk about. Ginger recently threw a dance party for a patient because the patient loves dancing and couldn't dance. That's the kind of person you are. We have some great questions coming in, some great comments coming in from the community. I want to take a moment to share with you the links that you can use to connect with us in real time right now. You can go to our Facebook page, our YouTube page, or the All Things Heart email, and we'll read your questions and comments out loud during the program. Ginger, you talk about working alongside Dr. Zorn and Dr. Muehlbach and the perspective it's given you. Having gone through this, how many times are you working with patients who are going through the same thing?
The exact same thing, probably, I don't know, once or twice a year. It's not very common.
It's rare.
But a coronary artery bypass every day, multiple times a day sometimes.
So you're seeing people at one of the most scary parts of their life, possibly. It's alarming to hear you need that. What does that look like when you talk about how you use your experience to connect with patients and ease the anxiety?
I think the first day when we try and get up and move is the hardest day for all of them because it's that fear of the unknown. What's this going to feel like? How am I going to get up? And knowing the restrictions that we have for them. I always say, you're not the first person that's done this. Probably not going to be the last. But if we get up okay, I kind of don't weave in my personal experience. But if I have somebody who's really struggling and really, really scared, I sit down and I say, I've done this before myself. Let me talk you through what helped me get up and what helped me do this. Let me help you.
I think I would start crying if a nurse told me that. I'd be so relieved.
Here we are. Let's get it done.
Do they react emotionally when you tell them that?
I get quite a few cards after the fact that say, why you didn't have to share that with me. And I'm like, you're right, I didn't. But in the moment, it helped you. And that's what matters at the time. Yeah.
It's remarkable. Dr. Muehlbach, this heart defect Ginger was born with, ARCA, it was on her right side. So how would you treat it if it was on the left?
The lefts are much less common, so we don't unroof the left like we do the right, but we would bypass graft. But it's a much less. These are very uncommon, as she said. She sees 1 or 2 patients like this a year. It's less than 1% of the population, so it's not that many, but it's certainly something that is common enough for us to recognize and treat. But more of them are right than left.
Is one side more difficult during the surgery than the other?
No, really, technically,
Same
it's
thing.
not that different between either side.
Okay.
We're in the same area, and in fact, hers comes from the left side, so we were kind of operating on the left cusp for hers.
So Ginger, what does your life and your continued care look like since this point? Do you have certain scans you have to get at certain points, or visits, or anything like that?
I see a cardiologist once a year.
And that's it?
That's it. Yeah.
How great is that?
It's pretty fantastic. Today might be that day.
And then real quick, how many dogs do you have now at home?
4 of mine. And then my brother lives with me, and he has a small Yorkie too.
And are you planning on fostering any
Never
others?
Again. We're good. We're good.
Right.
Like have the perfect size.
The perfect size
now.
is quite a lot. It's quite a lot for you. For anyone, I want to get to some of the questions from our community that are coming in right now. Ruth Allen writes, did Ginger take her blood pressure at home on a routine basis? Sometimes we've been advised to do so over a period of time and share on our patient portal. So did you do that?
Pre-op?
Yeah.
I didn't have to. I'm a nursing instructor is my side gig. Students practice on me all the time.
So they never picked up on, there was never high blood pressure until this one point you were donating?
Yeah.
Wow.
It's like a lucky moment.
Yeah.
Very lucky. Marie wants to know, are there less invasive surgical options to what Ginger had? Dr. Zorn.
Not really. They've tried other things like stenting or percutaneous options that have not proven to be very successful. The issue is the anatomy right there at the aorta is hard to deal with. So it does require a more invasive procedure to get to it.
Dr. Muehlbach, I have a long question from Jeremy Yenser. Buckle up. We love Jeremy. He writes great questions. There's routine stuff like mammograms, prostate exams, annual physicals, etc., that are a pretty calendar-based way to keep an eye on things. But for your heart, outside of eating well, getting exercise, and that kind of stuff, and hoping I notice something weird before it kills me, we all hope for that. What should making sure my heart is okay look like? So what do people watching need to do?
Well, I think even in Ginger's case, if you really listen to what happened, she had high blood pressure. Everybody with high blood pressure doesn't have an anomalous right coronary. So, but what that led to was her getting further testing. And so, what I would say to people is there is some testing that you can do that is pretty cheap. You can get it done for about $50. Unfortunately, it's out of pocket, but a cardio scan of the heart can be done, and it's primarily going to look for calcium in the coronary arteries. It's not going to identify an anomalous vessel, but it may identify some of the other abnormalities that people see. And so when we see people get coronary or calcium scores, we'll pick up on some of these other things. It's not suggesting that a calcium score needs to be done to find other things. The calcium score is done as a calcium score. But that would probably be really the only kind of out-of-pocket routine testing if somebody said, hey, I want to go do something, that they could kind of do that on their own accord.
Is calcium score the same thing as cardio
Cardio
score?
scan.
Because we did a whole episode on this, and those are so easy. It inspired me to get one. It was $50 out of pocket, but it was the easiest thing to schedule here.
Yeah.
I was able to get in within a month.
Yeah, super quick.
We've had now, I've interviewed 2 different patients who went in for a cardio score and came out learning that they had lung cancer, and they weren't smokers. This never would have been discovered if they hadn't done this.
Right.
How common is it, Dr. Zorn, that you see someone come in from something they had no idea they had, and it was because of a cardio score?
Oh, I think as a group we'll probably see a couple of patients a month that are identified with just a simple screening study like that. But it's not uncommon at all to have not just cardio scans, but other types of CT scans or other diagnostic studies that are looking at one thing that pick up another. So I think a lot of the aneurysms we see are picked up incidentally on other studies. Lung cancers and even some of the valvular abnormalities that we treat are just picked up on a routine screening study or diagnostic study for another reason.
That's such a great testament for why it's important to keep getting regular doctor's visits and getting your checkups.
I think another point that people miss sometimes, and we hear it often in the office, is you ask them their family history, and you'll hear people say, well, my father died of a heart attack. And you say, well, how do you know they died of a heart attack? Well, they died at home and he had a heart attack. But honestly, they don't know if he had a ruptured aneurysm or an anomalous right coronary and he had some other event. So it's very common that we hear of family members that have sudden cardiac death that don't have an explanation. And so I think it's important that when people realize that sudden cardiac death has occurred in their family, that there is some investigation as to maybe why that happened, because it's not always a myocardial infarction or heart attack that kills people. So there are many, many people that die, as we would say, suddenly at home that have no explanation.
Myocardial infarction is something that some people might not know what that is. What is
heart
that?
attack.
A heart attack.
Yeah.
I asked because the first time I heard that, I thought, what's a myocardial infarction? Along those lines, to what Dr. Muehlbach said, have you done digging into your family's history?
It's funny. Both my grandparents at the time were still alive. All four of my grandparents.
When this happened to you?
Yeah.
Okay.
So, not a lot of history in coronary disease for them. I have a younger brother who probably has some congenital situations. He was born way, way, way early, 24 weeks, and that was almost 50 years ago. So there's possibilities there, but no, nothing like that.
Without talking about anyone's specific medical information, has this inspired other family members of yours, though, to go get scans and
Definitely.
tests?
Yeah.
Which is very good. Has anyone found anything? Don't say any names.
No.
Great.
Not yet.
That's
But this
great.
is not hereditary.
Yeah.
That's even better.
This is not a hereditary problem.
So lucky Ginger just happened to you?
Yeah,
Indeed.
won the lottery.
Ooh, I don't like that. I don't like that at all. Sally has a great question. Sally wants to know, Ginger, are you able to donate blood again?
Oh, I donated blood like 2 weeks ago.
You did?
Yeah.
How often do you donate blood?
As often as I can. Here recently I've been doing double reds, which they limit you to like every 100.
What's a double red?
So you give double red blood cells.
Okay.
And there's a big machine, you're there for an hour, but typically it's 116 to 120 days apart. So you have to rebuild those red blood cells. My hemoglobin, like going in, is 14 and then coming out somewhere around 7. Yeah, it's great.
So how do you feel after that? You feel
I
tired?
feel fine. No.
How many times a year then are you donating blood?
Oh, probably 4 or 5 at this point.
Wow.
Yeah.
Yeah.
That's
I try and do it every
incredible.
time we have something here, because it's the easiest way to help. And as many of our patients need blood, you know the need is just huge.
It's so big. You're both nodding your heads. You're kind of lit up when Ginger talked about donating 4 to 5 times a year.
Yeah, we're pretty big consumers of the blood supply, so yeah, we definitely are users of it, so it's nice to give back.
As a surgeon, does that make your heart happy to hear that someone like Ginger is out there
Oh yeah.
donating so much?
Well, what's amazing is that somebody donates blood like that and then goes right back to work, because when your hemoglobin is 7, most people aren't very energetic.
Yeah.
I don't know what that would look like for you to not be energetic.
I'll let you know when I find it.
You're just cruising along.
Yep.
Do you drink coffee?
Nope,
Any kind of caffeine?
not really. No.
I don't. Those. When I hear that, I think you are from another planet. I don't know how people function without coffee, which is another question that Jenny has. Jenny wants to know: was it hard to be a patient when you were so used to being on the other side of that bed?
Extraordinarily. It was actually kind of interesting because I worked in different ICU. My ICU made some mitts, and we used mitts to keep our patients' hands still and not disturbing a lot of their devices. They made me mitts with all of their names and their signatures, and with little snide remarks about don't be the first one to self-extubate or leave your nurse alone.
Oh, the mitts are to keep you from grabbing things or doing things on your own?
Yep.
Was it to also keep you from grabbing the phone and calling people and trying to do things?
No.
But it was to keep you from getting in there.
Yeah,
and doing
keeping
stuff.
myself safe.
Right,
But
safe
yeah,
from
that was their
yourself.
joke. I was like, I love this.
Okay, I'll behave. I won't
This
do
one
that.
time.
We talked about the scans that were done on Ginger. And the scans you showed us, Dr. Muehlbach, what were those scans, Johnny asks, that were done on those images that you showed us? What gave you those images?
Called a coronary CTA or coronary angiogram. So it's a CAT scan that is kind of a specialized CAT scan.
Okay. Do you have to go through the tube to
Yep.
do that? So you sit in the tube, and what makes it more special? Is the experience any different?
Not really. They give you dye, IV dye, but the machine is somewhat connected to the heart, if you will, so that the heart moving and doesn't blur the images, so you can get a cleaner image.
Get a cleaner image. Patty wants to know, Ginger, have you spoken to the person who took your blood pressure that day?
Oh yeah.
You know who that is?
He actually still takes the blood pressure when you give blood here.
Oh, no way.
A couple of different times, yeah.
So when were you able to tell him that he saved your life?
I think the first time I donated blood again maybe was closer to a year out, I think.
Okay.
But yeah.
So what did you say? What did he say? How did that conversation go?
Remember that day when you took my blood pressure and it was 200 over 100, and he was like, "Oh yeah, I'm not going to forget that day because I made him take it on the other arm because I'm like, that's nuts." And he goes, "Why?" And I said, "I had to have open heart surgery because there was something really wrong, and had you not taken my blood pressure at that time on that day, probably wouldn't have known it happened, and I might not be here." And he's like, "You're kidding." And I'm like, "I'd really love a hug right now." And I was like, it was really kind of a cool moment.
I love that, Ginger. That's so
awesome.
cool. I want to bring us together for some takeaways for this conversation. And Ginger, I do want to start with you. What would you like our viewers to know about your journey and anything that they might encounter in their own health?
Everything happens for a reason. I know there's a lot of people that say that's not the case, but had I not had that blood pressure in that moment, I wouldn't have taken the step. So if you have something that is not right for you, investigate. Don't sit on it. It's not always going to be something benign. And take the steps to protect yourself and your family.
I'm sure since you work here, there's a lot of people watching you, a lot of other nurses that will be watching this program and say, "Yeah, I remember I cared for my colleague." What do you want to say to the people who cared for you?
Oh, they're the best humans I've ever met. I literally wouldn't be working where I'm working right now if it wasn't for them. And I am so proud and happy to be in the place that I am, taking care of the patients that I am, and it's because of them.
Is that why you transferred into
100%
cardiothoracic?
why I did, yeah.
How quickly after you recovered did you do that?
It was probably pretty close to a year, maybe a year and 2 months. It was December, so.
And that inspired you to change your specialty, really.
Yeah. I wanted to know more. There's just so much about the heart that isn't like any other organ or any compilation of other organs, and it feeds absolutely every organ in your body. So it's so interesting and so much to learn. Every day we learn something new and we see something that we've never seen before.
Yep.
Dr. Zorn, what would you like our viewers to know?
Well, I think one of the things is, don't get focused on this. This is an extremely rare condition. If you're listening or watching, it's very unlikely you have this. But it does point to the important part about keeping close contact with a family physician or a doctor, so that when you identify something that doesn't feel right or is out of order, then you can get it investigated. Because this investigation led to a place that nobody could have predicted. And so I think it's important to keep a close relationship with a family physician and as she said, pursue all options when you're not feeling right.
Be like Ginger. Dr. Muehlbach, what would you like our viewers to know?
Well, I think, as Tripp said, this is an unusual thing to find or have. But, we can operate, and we operate, and we do our procedure, and off we go to the next. And really, the way our patients survive and are taken care of are by people like Ginger. And so, her experience with the patients is much different than my experience with the patients. So I think, we're thankful that we have people like Ginger in the ICU taking care of them, because that's where it all happens. So it's clearly a team approach to taking care of our patients, but it's the bedside nurses that are the ones that really get them mentally through these difficult times.
Thank you for taking time to join our show, Dr. Muehlbach. Dr. Zorn, thank you so much. I know you both have more surgeries today?
He's in clinic today.
You're in clinic, okay. But you have your surgical cap
he's got
on,
the
so you're
tie on.
headed.
He's got the tie on,
all right.
so
Two
yeah.
different work days are
Yes,
about to happen.
right.
Ginger, thank you so much for sharing your journey.
Oh, you're welcome.
And I know you have to get back to your patients too, but we do appreciate the time you took to join us and share everything. And I want to thank our viewers as well for joining the conversation. If you'd like to watch or share any one of our shows, just scan the QR code that's on your screen right now. That will take you to links of all of our past episodes. We will see you right back here tomorrow morning for the Morning Medical Update.
Coming up tomorrow on the Morning Medical Update, an incredible story of a young woman needing a kidney to live and how social media helped her find her match. Now 2 young women are sharing their story. I'm Jessica Lovell on the next Morning Medical Update, living kidney donations and how to get that conversation started, Friday at 8.